Lauren Alexander, and this is my checkoff for med administration. So first, I'm going to start off by verifying the doctor's orders. So I'm going to go into DocuCare. Okay, so I need to go into the correct patient here. Oops. Okay. All right, so the orders that I have received are for a patient named Jonah Dinerman. So first I'm going to verify my order, then I'm going to do hand hygiene, knock knock. Hi, my name is Lauren. I'm going to be your student nurse today. I'm going to be administering several medications that your physician has ordered for you. This should only take a few minutes. Thank you for your time. I would then ask the patient for his name and date of birth and check his barcode on his hand. And the barcode says Jonah Dinerman. So I would say, can you please tell me your name and date of birth? And then he would do so, and then afterwards I would ask if he has any allergies or if he's in any pain. And if he's in pain, then I would administer pain medication, and then I would reassess in 30 minutes. So the first thing I'm going to do is check the orders in the MAR, and the doctor has ordered diphenhydramine hydrochloride 50 milligrams IM PRN, and he has ordered insulin regular, and that is dependent upon his glucose levels, and then metoprolol. Excuse me, the insulin will be sub-Q, and the metoprolol would be given IV. So the first thing that I'm going to do is I would probably need to calculate my med doses. So first I'm going to take a look at the diphenhydramine. So for the diphenhydramine hydrochloride, it says, oops, I'm looking in the notes right now just to see anything here. I'm going to start with that one, and it will be administered IM, so PRN. So I would definitely need to ask the patient, are you experiencing any itching? And it says that there's a nurse's note for PRN for itching or hay fever symptoms. And so I can take a peek in the vital signs. I don't see any notes there. And then, let's see here. Let's see here. So, so all I'm seeing is that he's going to need 50 milligrams intramuscular. So I would confirm that I have the right, or I need to find my drugs first. So let me grab my diphenhydramine here. Take this out of the package. And all right. So I would do hand hygiene and put on clean gloves. And then once I am, well, before I'm in the patient's room, I would verify that I have the right drug to the MAR for the right patient. So I have my diphenhydramine hydrochloride, 50 milligrams, and the vial that it comes in says that it's 50 milligrams per 1 ml, and the order is to give 50 milligrams. So I would give I would give 1 ml. So first what I would do is I would take get all my supplies together. So I have my needles. I'm going to be using a 1.5 inch needle, intramuscular. And then because it is going to be 1 ml, I'm going to just use the 3 ml syringe, empty syringe. And then I have my blunt tip needle. Sorry, my dog's running around. You'll have to ignore that. And some alcohol swabs. So then once I get into the patient's bedside, I'm going to go ahead and recheck the medication to the barcode, to the right patient, to the MAR. And just to be extra safe, I would probably double check being a nursing student. So we have the right patient and the right drug. So then I would need to get alcohol and clean the skin and just let that dry. And then while that's drying, I'm going to remove the cap from the medication, and with a new alcohol swab, I'm going to clean the top of the medication really good. And then I'll set that down. And then I will need my blunt tip needle. And my empty syringe. So then I could take a new alcohol swab and clean the top of this, but for purposes we're limited on supplies, so I won't do that for this. So I have my blunt tip needle, and then I am going to draw up 1 ml. You can see that 1 ml of air, and so then from there I will push this into the medication, push the air in, and then I will need to draw up 1. Let that air out. Beautiful. Okay, so I have exactly 1. So then I will need to remove the, I'm sorry, I need to recap. Since this isn't sharp, I'll just go ahead and use this, but normally I would do the scoop method where I just, remove this. It's very difficult to get off. Okay, technical difficulties. Let's see here. Why this isn't coming off here. Well, let me grab another one. So Guess this is just what happens sometimes. 1 second. Sorry about that. Okay. So I would do hand hygiene, change my gloves, put new gloves on. And then I would need to do new alcohol on the medication. So I would take my syringe. I'm gonna try this one more time to get this off, but I don't think it's gonna budge. I'm not sure what happened. And my blunt tip. Attach this. Let me drop the air here. Well, I'll attach it now. Okay, so 1 ml. Push the air in. Draw the liquid out. Perfect. So I have 1 ml here. So now I can do the clean scoop method here. Perfect. And take the blunt tip needle off. And then since we're going to give this IM, I'm going to do a 1.5 inch needle. Okay. Remove the cap. And I've already swabbed the skin, but I could do that again. And then I would let the patient know that he's gonna experience a big stick. And I would draw back, and then to make sure I am in the right spot, and then I would push it in. And then once I'm done, do the safety, and then I would dispose. So after that, I could put a Band-Aid on the skin or whatever I would need to do. So then I would let the patient know, you know, the medication can have some side effects, can make you a little drowsy. But let me go ahead and hit that I have administered this. And I have the right patient, right drug, right dose, right route, right time. I've completed my 3 checks. And I have checked his band and administered. Okay, so next up, we are going to give the insulin. So, let's see here. First, I need to take a look, and so his insulin says blood glucose minus 100 divided by 30. So let's take a look at his vitals and his diagnostics. All right. Let's see here. So, under diagnostics, I see that his glucose is at 376. So he does need some insulin. So I would do 376 minus 100 divided by, divided by 30. So let me get my calculator up, because I can't do that math. 376 minus 100 divided by 30 is 9.2. So he needs 9 units. Okay. So next I need to make sure that I get the right medication. Oops. So I have regular insulin. I need a, this is an insulin needle, and it shows that it goes up to 50 units. So that's great, because I just need to give 9. So let's see, anything else about the insulin? All right, so I have the right patient, I have the right drug, and this is regular insulin, 100 units per ml. And it says that there's 10 mLs in here. So we're gonna give 9 units. The route is gonna be sub-Q and the time. And then I would check the MAR to the barcode, scan the barcode. And then before hitting administer, I would need to new alcohol wipe. And I forgot to mention that with the IM injection for the diphenhydramine, I would be giving that in probably like the deltoid area because it is IM, so it's got to go into that muscle. For the sub-Q, I wonder if it says where. I would give it in the abdomen, or I could give it behind the arm, but mainly it's normally given C note. So let's just see the note. Let's see here. Notes. Notes. Okay, let's see here. All right, he has BMP with elevated glucose, right? I forgot to mention this note that I was reading earlier. I didn't say it out loud. With the diphenhydramine, the patient is complaining of stuffy nose, headache, and itching eyes. There's no rash or hives. He takes Benadryl already at home every 6 hours. So I should have mentioned that. I was reading over that in the last one, but I forgot. So with this one, his glucose is high, so we are going to give this. Okay. So I'm going to give this in your abdomen. I would clean with new alcohol on the site and ask where he last had his insulin injection so I can rotate sites for him. So then I would need new alcohol and get the cap off of the insulin and scrub this with alcohol as well, really well. And then I would need to go ahead and do the air first. Let's do 9 units of air. All right, great. 9 units of insulin. And you're going to feel a big stick. I would just pull back, push that in, and that is sub-Q. And then I would need to do the safety and dispose. Perfect. Okay, so let's go ahead and in my MAR, I will document that I have administered the insulin, right patient, right drug, right dose, right route, right time, 3 checks, check the wristband, and, oops, administered. Okay, so also another thing that I totally forgot to state was that I had previously checked the expiration dates on these. So I'll go back, and the diphenhydramine doesn't expire until 2025. The insulin doesn't expire until 2024, and then I will also be giving metoprolol in a minute, which doesn't expire until 2023. So all expiration dates have been checked. Okay, so now we're gonna do IV. So for the IV, I would need to first assess the skin and make sure everything looks okay. And then it is clamped right now. So I need to make sure that I have some flush so that I can go ahead and flush some medication, or I can flush the IV first. So I get this ready, this ready. Let's see here. Okay, and then I need my needles. IV. That's IM. Here, no, that's IM. I have my blunt tip right here. And I have everything labeled. I don't know where it went. Okay, well let me grab another needle. Sorry about that. Okay. So, all right. So I also forgot to, I don't remember if I even said the needle sizes that I selected. I selected the insulin, let's see here. Oh, I guess I did use the IV. Okay. Well, so for the, okay, all right. So first I'm going to take my alcohol and scrub this really well to get rid of all the cooties on here. And then he's been ordered metoprolol, so I would let the patient know that, this can make you a little lightheaded. So I would need to get some alcohol and scrub the top of this medication. Okay. And then once I'm done with that, I would take my saline flush and I would go ahead and unhook or unclamp. And then I'm just gonna push in 3 mLs here. And it looks like it's going in well. So I could take this off and then I could re-clamp it. So now the IV is then flushed. So then I'll take my metoprolol and make sure I have the right drug. it says here that this is going to be 5 milligrams per 5 mLs, and he needs 3 milligrams. So you have 5 milligrams per 5 mLs, and you're going to give 3 milligrams. Then let's see, 1 milligram per. He needs 3 milligrams. So I would be giving him, let's see, 5 milligrams per 5 ml, or 1 milligram per 1 ml. And he needs 3 milligrams IV. So I would draw up, I would drop 3 milligrams. Let's see here. Yep, 3. So scrub the hub on this, and then I would need to make sure that I have a he needs 3 milligrams. So I would be doing 3 mLs on here. And then I would attach my blunt tip. Push that in. Perfect. All right, awesome. And I have my 3 mLs. So this is going to be going into the IV. So I would then need to recap the blunt tip and remove. And then I would scrub the hub again with a clean alcohol wipe. And then I could also scrub this. And then I would just attach it. And I would let the patient know that I'm going to be administering this metoprolol very slowly because it will cause his blood pressure to drop. And I need to unclamp this. So I would probably do this over like 2 minutes at least. Once all of this is in, I can remove this, dispose of this. I would then clean the hub again and then get some more pre-filled syringe. Actually, I could use the other one, but I'll just use this one. So I'd scrub the hub, attach this, unclamp again. I'm going to do about 3 mLs. And that went in well, so I'm going to clamp this off, and then I would reattach this to the side. So after I have completed this, I would go into the MAR and hit administer. But one thing that I forgot to do that I'm just now noticing is that that I was supposed to check the heart rate. So heart rate less than 60 or SBP less than 90. So I would go into the vitals, and the heart rate is 85. So I don't need to hold it. So hold for heart rate of less than 60, and he's at 85. So he's okay to have this medication. So I'd hit administer, right patient, right drug, right dose, right route, right time, rechecks, hospital number, and administered. So after all of this, I would make sure that the patient is doing well. I would assess the patient, clean up all my trash, and then once I have seen the patient and made sure he's doing well, I could lower the bed, raise the side rails, give him his call light, make sure the head of the bed is elevated, and then see if he needs anything else at this time, and then I would go document. So going forward, I would make sure to check any notes and any new labs that come in before administering any medications. Thank you so much.